All right, we're at the end of Leni's second week of her rotation here at 180 Physical Therapy. She's a student from Long Island University's PT program, third-year student, and she's going to tell you about what her biggest takeaway was from this week.
All right, so this week we saw a lot of new patients, and I think my biggest takeaway was how Rhett's program really targets the root cause of patients' pain, whereas traditional PTs that they may have gone to in the past will look to cover up symptoms of that pain. They don't look at the person as a whole, so they're only addressing the part that hurts. For example, we saw a case who had some low back pain and was told at a traditional PT to keep it as straight as possible. They addressed his symptoms while he was in the office, but they eventually came back. Not surprisingly, he really isn't moving his back at all. He's really stiff, and traditional PT targeted more of his stabilizers, which keep him in that position. So in his first visit, Rhett was working on getting him more mobility in his spine as opposed to that guarded position, and it made a big difference in him.
Cool. So talk about, I know last time we talked about how her biggest takeaway was using a screen with every patient, both pre and post treatment. So talk about, today was our second time seeing this individual who's actually a firefighter, who's on work comp, who's now not working because his back pain is so bad, getting MRIs and scheduling injections and those types of things. So talk about what we saw in the screen on his first visit versus what we saw today.
So his first visit, even during his gait analysis, he was walking very rigidly, no movement, no dissociation between spine, pelvis, hips, everything. In his squat and toe touch, his spine was just straight the entire time. He had a really hard time with rotation too. His whole trunk moved together. This time, even on his initial screen, he was already showing more dissociation and rotation during his movements, which is good.
And he even said during the eval, he said, yeah, I'm working really hard on my stabilizers. So that's when I kind of laughed, and I looked at her and I said, okay, so we're going to work on getting you out of the motion, out of the position that you've been working so hard to stay in, because that's what's pounding on your back and your discs and your nerves and all the stuff that's going on. So that old school PT that he received years ago came back to manifest as what he's got now. If somebody would have seen him years ago and said, oh, you've got this dysfunction because these muscles are not doing their job, I can get those muscles to work for you and teach you how to keep them working, then he wouldn't be in the situation that he's in now. So so there it is. There's Leni's take-home biggest thing that she got out of this week, which is get to the root cause. Which, did you learn how to get to the root cause in school?
No.
No. She didn't learn how to get to the root cause in school, and neither did you. But the important thing is you learned all of the little ingredients to get to the root cause. They just didn't teach you how to put the ingredients together, which is what we do with the 180 system. So you know anatomy, physiology, biomechanics, so we didn't do anything that you'd never heard of before. We just put it all together into one system so it actually makes sense, and patients aren't getting worse, they're actually getting better on a functional level versus chasing symptoms like she mentioned at the beginning of this video. So check in, stay tuned from here until next week, but check in next Friday and we'll do another video and see what she picks up next week.